We're going to be talking about National Epilepsy Awareness Month with Dr. Isaac Mezo, neurologist with Morris Hospital's neurology specialist. Dr. Mezo specializes in the diagnosis and treatment of disorders that affect the brain, spinal cord, and nerves. Our topic today is epilepsy, so I guess we'll start. If you could kind of explain what someone with epilepsy experiences.
Of course, people with epilepsy experience different kinds of spells. Some may stare, they may have some lip smacking, some people may lose consciousness, fall and convulse, the typical epileptic seizure. Some people may have a jerk or a twitch, but most of the time it's some sort of alteration of consciousness. The main point being that every case is different, and these spells really have a negative effect on a person's quality of life.
All right. Well, what causes epilepsy?
There are many causes of epilepsy. Many people are born with it, perhaps a result of a metabolic problem or a genetic problem. It can also occur as a result of a previous brain injury, such as a severe trauma you've had, a brain infection, or a brain tumor. In older people, for example, the most common cause is a result of a previous stroke. It's called post-infarct epilepsy. Anything really that leaves a scar in your brain, it will cause a short circuit, if you will, resulting in a seizure. Alcohol withdrawal, certain drugs can also cause seizures. Interestingly, about half of all cases of epilepsy are due to an unknown cause, and we may never find out why the seizures occur.
Is epilepsy common?
It is very common. It actually is underdiagnosed throughout the United States. We have patients who are initially tested when they are kids for staring spells and thinking they may have ADHD, and it turns out they have seizures. So it is more common than we think. We just underdiagnosed.
All right. Well, is diagnosing epilepsy a difficult challenge?
It can be very challenging. It's especially challenging when people have different kinds of spells and you don't know if they're passing out from some other cause, perhaps a cardiac cause, or maybe it's epilepsy. We use different modalities to try to diagnose epilepsy, including brain imaging. We use the encephalogram, known as an EEG, electroencephalogram, Still, many times diagnosing epilepsy takes several months. You want to be sure that these are seizures indeed and not some other type of spell. So it definitely can be challenging.
All right. Well, what are some treatment options for managing epilepsy?
Nowadays, we have very efficacious medications for epilepsy. There's always new seizure medications with less toxic side effects than the previous ones. We also have other treatment options, including brain surgery, which could be appropriate for certain populations of patients. It all depends on the cause of your epilepsy. There's also a lot of patients with refractory epilepsy that's very hard to treat with medications, so they benefit from other devices such as vagus nerve stimulator, deep brain stimulator. One thing I don't want to forget to say is that getting enough sleep at night and not missing your seizure medicine are some of the most important things when treating epilepsy, because the seizure medications can be very efficacious if taken accurately.
All right. Well, what can a person do if they're around someone who has a seizure to help them out?
Oh, of course. The most important thing is do not panic. If you find somebody who's having a seizure, you definitely do not put your fingers in their mouth. Do not try to stop them from biting their tongue. All you do is you clear way for them to convulse. You help them down on the floor so they don't hurt themselves, and you call 911. If you can, you turn them on their side. But really, you want to call 911 and get help. Now, there are some rescue treatments if you know this person and you know they have this rescue treatment with them. They're usually nasal sprays. You can administer it, and it could stop the seizure. But again, this is only if you know this person, you know how to use this device, they have it on them. Otherwise, again, you clear way and you call 911.
Yeah, keep them as safe as you can and get the medical professionals on the way, right?
Oh, absolutely. That's the most important thing.
Sure. All right. Anything else before we close?
Well, I just want to make sure that everyone knows if you're having any kind of spell, any kind of passing out or staring spell, you have to get help. You can call our office. If you have been diagnosed with epilepsy, there are resources out there. The Epilepsy Advocacy Network serves the greater Grundy County area, and they offer quarterly support groups in Morris and in LaSalle. So that's another option as well. They're at epilepsyaadvocacynetwork.org.
All right, fantastic. Well, Dr. Mezo, as always, thanks for spending some time with us this morning. Certainly appreciate it.
Of course, I'm glad to be here, Kevin. Thanks for having me.
Dr. Mezo sees patients in Morris and Shanahan along with the other neurology specialists. Morris Hospital's neurology specialists treat stroke patients, epilepsy patients, Parkinson's patients, headaches, chronic migraine, seizure disorders, dementia disorders, sleep disorders, multiple sclerosis, COVID fog, infections of the brain, and other neurological conditions. To learn more about Morris Hospital's neurology specialists, go to morrishospital.org and search neurology or call 815-942-4506.